Hi, this is Dr. Guy Citron. I am the Chief Medical Officer and co-founder for EndoAxis Labs. Today, I'm going to be reviewing a case with you about a female who went some pretty bad PMS and some other symptoms. So we'll get started. Today, we're going to be reviewing a female, 40 years old. She came in, her initial visit with me was July 16th, 2024. She came in with PMS, anxiety, weight gain, and brain fog. She was pretty miserable. She started to put on weight for the past 6 months or so. She put about 8 pounds on. She said her diet has not changed at all. I see this so commonly right at around the 40-year-old mark. PMS started as well, probably a little bit longer, about 12 months of PMS. She started to feel like about 7 to 10 days prior. Moods have gotten worse. She experienced significant anger, a lot of irritability, sadness, fatigue, and significant sore breasts during that period. She fatigues heavily, specifically the day directly before her period, and started to notice a lot of brain fog as well, intermixed with her period. Cycle length was relatively normal, period length was relatively normal. Again, started about a year ago. So I ran both blood work and her Dutch test in her labs. Free total testosterone was relatively normal, 4.3. Sex hormone binding globulin was a little bit higher out of the reference range, 8 points higher. Total testosterone looked normal. Free testosterone and bioavailable testosterone potentially slightly on the lower end, maybe still 20–30% of utilization. Thyroid panel came back completely normal. Sed rate was very healthy. All her markers looked great in terms of the fatigue. Iron panel, all of that came back normal. We ran a comprehensive lab test, which I typically do with all my patients. Everything looked great. Progesterone looked healthy. Again, this was 5 days after ovulation. Prolactin was healthy. LH and FSH, even though I typically test those on day 3 if I'm trying to help patients conceive. Vitamin D was flagged slightly low, and estradiol, and I typically only run ultra sensitive, came back great. From blood work alone, this is a beautiful case of why the Dutch test is so great. So I ran her Dutch. Her estradiol total, E2 was flagged high. Progesterone was on the slightly higher end of normal. Testosterone slightly lower end of normal. DHEA production, adrenal functionality looked normal upon glancing. DHEA looked okay. Again, testosterone mostly okay. 5 beta, a little bit preference towards that. Progesterone looked more or less healthy when I was looking at it on the report itself. And then again, her E1 and E2 were a little bit elevated. E3 was on the higher end. So her estrogen markers across the board, a little bit higher. 2-methoxy-E1, a little bit on the higher end of the range. Again, methylation activity looked more or less normal. I didn't see anything other than a little bit of high estrogen activity. The assessment was elevated sex hormone binding globulin, which is probably reducing her ability to process or feel her hormones. And then everything else, that's the full panel I ran. Everything else was normal. Dutch revealed high E1, E2, and cortisone low upon waking. But that was pretty much it. And then the E-code alone for the 5 beta testosterone. So I ran her EndoAxis report, and it said, although progesterone is within luteal range, she may experience estrogen dominant symptoms. Testosterone was flagged low for an ideal range. And this is a really beautiful area that I'd like to emphasize with the EndoAxis report. If a patient is going to say my testosterone is totally normal in the blood work, EndoAxis is going to do a ratio for age range. So this might be a really nice way to kind of tell your patient, listen, you are experiencing low testosterone symptoms and it was flagged. And so this pattern overall reflects an ovulatory cycle with estrogen excess. If her testosterone, but again, that's just through the Dutch. In the labs, it looked normal. So if her total testosterone and serum is equally low, there may be concern for aromatase activity, basically meaning that with a little bit more adipose tissue or underlying sugar imbalance, she can start to migrate that gene from testosterone to estrogen, causing a little bit of that excess. So the focus was to support that genetic through sulfation biliary GI conjugation of estrogen, which is phase 3, while mitigating the aromatase activity to support the androgen estrogen balance. And this again is a really beautiful line. If you're trying to come up with an initial target for what you're trying to get your patient to agree to, the EndoAxis report is really beautiful. Again, it's a free report you can give to your patient. And the adrenal pattern came up. to support, including nutrients that optimize thyroid, mitochondrial response. Again, liver, biliary health came up again with adaptogenic herbs. Again, we are going to have a separate supplementation recommendation based on the Dutch report itself. Formula 5 was designed specifically to support androgen activity and production in women. This would be a beautiful blend for her case because she was flag low for testosterone. Formula 2 is really nice because it specifically targets phase 1 and phase 3 detox activity of estrogen. So it'll efficiently process the estrogen, liver, biliary conjugation, and gut health, specifically targeted to this patient. I don't think it can get more specifically targeted between Formula 5 and Formula 2. And 18 is our adrenal blend. Because of the fatigue and the low cortisone upon waking, this supports cortisol rhythm and activity during the day. And it's a broad spectrum thyroid supportive nutrient as well with mitochondrial enhancing nutrients. So again, another targeted formulation for this patient specifically based on the things that the Dutch test revealed. The add-ons are optional. So in this case, Formula 4 is a beautiful blend for PMS. I cannot tell you how often I'm seeing really supportive patients are loving Formula 4, truly loving it for PMS symptoms. It's working for the majority of the patients I put it on. Formula 15 was also as an optional add-on to lower sex hormone binding globulin specifically. So I met with the patient. I provided the full documentation, told her everything that we're thinking of, and I asked her, "Do you want to start with the foundational blends, or would you like to move to everything?" She was pretty miserable. She says she can't deal with this anymore. It's taking away a quarter of her month, and she's feeling awful. So she was fine to take an extra few supplements. It wasn't a big deal for her at all. I always typically advise to work, with my patients based on what their comfort level is of supplementation. And in this case, because I'm a prescribing doctor, I did want to give her testosterone to just support the testosterone, the low androgen production. But I did give her all the other formulations to support everything that we just mentioned. So I wanted to put her on it. I wanted to follow up with her in 4 weeks, kind of wanted to get her out of the fire a little bit. On her 4th visit with me, this was October 2nd, she lost about a pound to 2. So we started making progress. She was very happy. Irritability and erratic moods improved by 40 to 50%. So I was very happy with that. Within about a month, we were noticing 40 to 50% improvement when I put her on the correct things. Brain fog completely improved overall. She felt the adaptogenic blend, Formula 18, she felt she was much more focused, had much better energy, and the big thing that there was no more breast tenderness, that completely resolved. So I didn't want to change anything. I kept her on the same things. The next visit was exactly a month later. She went down another couple pounds. So we're headed back into where she started at 140. Still had 4 pounds to lose, but she was happy. Her PMS and irritability and erratic moods improved by 80%. Fatigue was completely resolved. So she was ecstatic, and brain fog stayed resolved. I took away the add-ons. This was a conversation that I had with her. She said she was happy to see what blends were really optimal for her. And if she felt like she needed the other blends, if things were coming back, she had them handy. So she knew what to do. So I just put her on the specific supplementation to support her health. And I recommended that we follow up with her in 4 weeks. Unfortunately, I have not seen her. I think she had to travel, so I'm assuming that she's doing great. Otherwise, I know I would have heard from this case. So although I don't have the end of this case study, you could see the progress and the benefit. I'm just noticing incredible results using EndoAxis, and I hope you do too. I hope this was beneficial for you. Look out for more emails. We'll be in touch. Thanks.